Dear ladies and gentlemen, friends of sexual medicine in Europe and maybe all over the world, I would like to talk to you today about a very special issue, which is the development of a curriculum in sexual medicine for medical students and psychology students, so on the undergraduate level. And this development is part of the cost action European network in sexual medicine, where we have different working groups. And the curriculum in sexual medicine is at the center of working group 3. And I would like to introduce you to this work. Now, when we got the task to develop this curriculum, we were first looking into what is actually the standard of a university-based curriculum. And I think modern curricula are actually based on the concept of competency-based curriculum, where it is quite clear what do you want to transmit, what do you want to obtain on the competence level in those students who take part. That needs, of course, a clear definition of the learning objectives in 3 domains: the knowledge, the skills, and the attitudes. The curriculum needs also a description of how the students are educated and taught to. It needs a mechanism of evaluation and feedback, and of course, the implementation of such a curriculum, which in itself is a research project, actually. So we were putting together the different input regarding the competences. What should medical students, psychology students really obtain as competences in the field of sexual medicine? The undergraduate student should be able to perform a sexual history, which includes the assessment of sexual health risks and sexual concerns. She or he should be able to encourage questions and create an open, confidential, non-judgmental atmosphere, following the principles of patient-centered communication and patient-professional relationship based on trust and respect. She or he should be able to counsel patients on sexual health protection and promotion, like, for example, contraception, STI, violence, etc. Should be able to encourage questions and inform and educate patients about the basic facts of the anatomy and physiology of the human sexual response. Address proactively sexual well-being in a respectful, non-invasive manner. And take care of patients with sexual problems by practicing patient-centered counseling based on empathic listening, providing evidence-based information, and discussing solutions. And finally, which is also important, that the future doctors, psychologists, psychotherapists should be able to communicate, educate, and counsel not only the individual patient, but have the skills to include the partner in the process in a dyadic setting. So if you look at these different learning objectives, you can say this is can be summarized into different chapters, which I'm coming back to in a minute. That it's about sexual history, focusing on risk protection and prevention, sexual history focusing on sexual health. It's about education and information, where we have to learn a lot from sexual education in adults. And it is about, as I mentioned, sexual well-being, where we need input from those, the literature and the competence coming from diagnosis and treatment of sexual dysfunction and basic care concepts like the implicit concept. So Let's look at the learning objectives regarding knowledge. The undergraduate should know and understand the definitions of sexual and reproductive sexual health and rights and diversity and sexual cultures, the different sexual cultures. She or he should know about the basic anatomy and physiology as well as the psychology of the human sexual response in a biopsychosocial framework. The sexuality-related health risks and how to prevent these risks should be known. She should know the most frequent disorders of sexual well-being, the so-called sexual dysfunctions, their diagnosis and treatment options. He or she should know and understand the impact of the most frequent diseases on sexual health. And finally, know about the specific sexual health needs of sexual minorities and how to respond to them. So these are the main knowledge-based contents. Now, regarding the skills, she or he should be able to address sexual health issues in a patient-centered, respectful way, to address sexual health issues in a couple, considering both perspectives, partners' perspectives in a respectful way, to take a sexual history as part of a general medical and or psychological mental history, to establish a descriptive diagnosis of the sexual health problems, sexuality-related disorder, to counsel about possible solutions to the sexual health problem, and to respond to the specific needs of sexual minorities on the level of communication. Finally, regarding attitude, the undergraduate should be aware of his or her beliefs and values regarding sexuality and the impact of these on her or his care for patients. And she or he should be aware of the large variability of sexual expressions and develop an open, non-judgmental attitude. Now, let's go for the knowledge-based part, the content, the structure, and the teaching methods. As I said before, these three parts should be integrated in the curriculum. And for each part, we should have the specific elements of knowledge. We should have the specific teaching methods of knowledge. We should have the clear description of the skills with teaching methods and the clear description of the attitude with the teaching methods. Let me first talk about the knowledge. We were discussing this in our group, and we finally came to the conclusion that knowledge should include basically 8 topics. One topic is sexual health concepts, the definitions. What is sexual health? The importance of sexual health for general health, the different dimensions of sexuality, and the variety of sexual expression. The second topic is the body and sexuality, the biological processes and constituents of human sexuality, the human sexual response, the development of the human sexual response, anatomy, physiology, endocrinology as basic knowledge from the biological side. The third topic is psychology of the human sexual response, instinct, drive, cognition, emotions, and behavior. The biopsychosocial model and sexual biography, sexuality and the life course. The fourth topic would be sexuality-related health risks, unintended pregnancies, STIs, including HIV, sexual violence, prevention, maintenance, and promotion of sexual health. The fifth topic would be sexual dysfunction in the male, the definitions and prevalence, the diagnosis, the types of treatment. The sixth topic, sexual dysfunction in the female, where we would like also to include, where we are including sexual dysfunctions in the couple. Then medical illnesses and treatment impact on sexuality, to look at the different medical conditions from cancer, cardiovascular disease, psychiatric disease, and the impact of these medical conditions and their treatment on sexuality. And finally, the topic on sexual health of what you would call minorities, LGBT, gender dysphoria, paraphilia. And all these different aspects of knowledge would be put together as lectures, which we are producing. We are in the process of producing these lectures as slide sets, as texts, but also as videos, in which these different topics will be taught, giving the opportunity to those who are interested to use it in their own teaching efforts at different, ideally, of course, at faculties all over Europe. Now, I just give you a little bit some insight in what we are producing. A lot of it we have already produced. The topic 1, what is sexual health, WHO, CDC, UNFPA, the different classifications, our body and sexuality. We have produced the impact on the sexual response cycle, endocrine regulation, neuroanatomy, how do we learn sexuality, the psychology slides. We are producing contraception, STI, HIV, sexual violence material, sexual well-being, the definitions of dysfunction, men, women, and couple perspective. We look into the different medical conditions and their impact, always based on evidence. And finally, we are also putting together the care of those who are different LGBT community and the special needs of these communities. The work on these topics is ongoing. Some of them are already more or less finished, and we will also take the opportunity to produce videos on these different topics. Now, the second part is besides the knowledge. As I mentioned before, it's about communication skills. The basic issue is that with communication skills, we would be able to create a positive atmosphere in the context of sexuality. There are different steps which can be learned to reassure the patient of privacy and explain confidentiality, make efforts to ensure patient trust, comfort, and openness, utilize empathy and build rapport, use open body language and appropriate eye contact, be aware of patient's cultural background, avoid assumptions about sexual orientation, gender identity, monogamy, sexual activities, or age-related practices, use simple direct language within your comfort zone, avoid unnecessary interruption while utilizing gentle redirection, disengage from electronic medical record, turn away from computer, and avoid typing. Now, these are, of course, the general elements of patient-centered communication, which should be integrated into the sexual interview. When we look at the literature and what has already been developed regarding sexual history taking, there is good material about 3 parts of sexual history taking, where you have one part which is about risk assessment, the second part which is about well-being and quality of life, and the third part which is about sexual history taking in the context of disease. So these 3 elements can be taught and can be integrated into the teaching program regarding the skills. Let me show you a little bit more in detail what that means. Some of you may already know the famous 5 Ps regarding sexual history, the risk assessment. It's about partners, practices, prevention of pregnancy, protection from STDs, and past history of STDs. You have to learn to communicate. Do you have sex with men, women, or both? In the past 2 months, how many partners have you had sex with? In the past 12 months, how many partners have you had sex with? Is it possible that any of your sex partners in the past 12 months had sex with someone else? The practices, these are just, choices of questions which can be adapted to understand your risk for sexually transmitted diseases. I need to understand the kind of sex you have had recently. Have you had vaginal sex, meaning penis in vagina? If yes, do you use condoms? Never, sometimes, or always? Have you had anal sex? Have you had oral sex? So, of course, these questions have to be developed in the context of a trustful relationship, but the questions have to be normalized. For condom users, if never, why don't you use it? If sometimes, in what situations do you use it? What about prevention of pregnancy? What do you to protect yourself from STDs and HIV? Have you ever had an STD? Have you ever had a partner who had an STD? And additional questions about the risk for HIV and viral hepatitis, regarding drug use, special sexual practices. Now, this is the first part. The second part of the interview is about sexual health. I'm sorry about the part 2. It's about sexual health and wellness. It's called the plus part. It's about trauma and violence. So you have a history of unwanted sexual experiences. Have you ever been forced or coerced to have sex against your will, either as a child or as an adult? If yes, is there anything about that experience that impacts your current sexuality? If yes, is there anything about that experience that makes seeing a healthcare provider or having a physical examination difficult? If so, I'd like to hear about this so we can work together more easily. The support for sexual orientation and gender identity. Do you feel you are getting support and acceptance of your sexual orientation, gender identity from your family and friends? Are you experiencing any harassment or violence at home, at work, or in your community due to your sexual orientation or gender identity? And finally, the other part of part 2 is about sexual wellness. It's about sexual concerns and problems. Are you having any concerns with your sexual functioning or your interest in sexual activity? Do you have decreased or increased interest in sex? Do you have difficulty becoming sexual aroused, becoming lubricated, developing an erection? What about maintaining lubrication or arousal or maintaining an erection? Do you have difficulty having an orgasm, orgasming too soon or not soon enough? Is sexual activity painful? If yes, what type of sexual activity is painful? Where is the pain? Are you having any sexual relationship difficulties, such as discrepancy between your and your partner's interest in sex, or your partner's having sex difficulties? And the question about sexual distress, looking into how much do these changes distress you? On a scale from 1 to 10, with 10 being the greatest impact, how much impact has this problem had on your life? How distressing are these symptoms to you? Again, the famous question on a scale, being the 10 being the greatest satisfaction. How satisfied are you with your sexual health or sexual relationship? That gives an approach which avoids yes/no questions and which allows some differentiation. So this type of communication in the field of sexual health and sexual medicine are also part of the program. The third part of the skills is students should be able to learn how illness-related sexual interview, to screen and identify sexual concerns or diagnosis of dysfunction in the context of disease, breast cancer, any other cancer, cardiovascular diseases. That they should be able to make a clinical assessment of sexual dysfunction. Basically, what is it really? What are the factors of the disease or the treatment that may contribute to this low desire, to this pain, and that they have empathy and counseling skills, utilizing support, giving education and information, and that they should also know about possible referrals regarding the solutions in the context of disease for sexual problems. And finally, the attitudes and their training is, of course, part of the case discussions in the skills training, and also questions and discussions in the context of lectures, where the objectives are actually to create awareness and reflection on personal beliefs and values towards sex, help understanding and accepting the large variety of sexual expression and identification, and understanding ethical principles and ethical issues regarding sexual behavior and sexual expression. So this is the outline of the project I was talking to you. And as I mentioned, we are working on the development and creation of a curriculum based on knowledge, skills, and attitudes, where we try to develop the necessary material for all those colleagues at medical and psychology faculties who are interested to integrate this part of education into their general curriculum. So thank you very much for your attention, and I hope we will have the opportunity to get in contact with each other via the website of the European Network on Sexual Medicine, and other connections which we have since many years. Thank you very much, and hope to hear from you.